38% of Americans delayed medical care due to high cost. U.S. agencies are spying on Americans' 150 million money transfers. Richest 1% gain 2/3 of $42 trillion in new wealth, says Oxfam. Leaders from Jordan, Egypt, and Palestine hold Trilateral summit to discuss Palestinian cause. Saudi Arabia hosts first international women's football tournament. New Zealand Prime Minister Ardern to step down. From Toronto studios, this is the Muslim News on Muslim Network TV. Assalamu alaikum. I'm Saamiyah Syed. Our top story tonight, nearly 40% of Americans say they or a family member delayed medical care last year due to a high cost of treatment under the nation's for-profit healthcare model. That's according to a Gallup survey published Tuesday. Lower-income households, young adults, and women are especially likely to have postponed medical care due to high costs. The survey also noted that health insurance companies made nearly $12 billion in profits last year. We must end this corporate greed. We need Medicare for all, Senator Bernie Sanders tweeted in response to the new findings. A special segment is coming up later tonight on this topic, so keep watching Muslim News. The latest Twitter Files thread exposing the inner workings of the pre-Elon Musk era dropped on Monday. It disclosed how pharmaceutical companies pressured the social media giant to censor activists voicing generic COVID-19 vaccine advocacy. But global drug giants saw the crisis as an opportunity for unexpected profit, tweeted investigative journalist Li Feng. Behind closed doors, Pharma launched a massive lobbying blitz to crush any effort to share patents for new COVID-related medicine. He said the Twitter representatives responded quickly to the Pharma request. Last May, Pfizer's COVID-19 oral antiviral Paxlovid was among 23 products the pharmaceutical giant agreed to sell at cost to the world's poorest countries. Now it has expanded the program to sell its entire suite of about 500 products, opening up access to its drugs to 1.2 billion people in 45 countries. The company has been strongly criticized for its uneven distribution of shots. It has also faced censure for initially resisting calls to share its intellectual property rights. The list of U.S. states banning TikTok on government-issued phones over cybersecurity concerns continues to grow. Wisconsin and North Carolina are the latest to do so. As of January 2023, at least 26 states fully or partially prohibit officials and employees from using TikTok on government-issued devices. Launched in 2016, the Chinese-owned video-sharing app became massively popular across the world in recent years, reaching 755 million global users in 2022. 2/3 of American teens are now TikTok users. But it has allowed the Chinese government to access users' sensitive personal data, including location and browsing. The U.S. Army had already prohibited TikTok on military devices. The U.S. Senate passed a bill in December last year to prevent federal employees from using TikTok on government devices. Hundreds of federal, state, and local U.S. law enforcement agencies have access to a database of more than 150 million money transfers. Common Dreams reports that this is all without court oversight. Private financial records are being siphoned indiscriminately into a massive database. Nathan Fried-Wessler, deputy director with the ACLU's Speech, Privacy, and Technology Project, also noted that virtually any police officer who wants that information can access it. Egypt-born Dr. Nemat Shafik has been named the first woman president of Columbia University. She will assume the presidency of the institution in July. Shafik is an economist who has served as president of the London School of Economics for over 5 years. She has also served as Deputy Governor of the Bank of England, Vice President at the World Bank, and as a Deputy Managing Director of the International Monetary Fund. Born in Alexandria, Egypt, she speaks English, Arabic, and French. The New York Times reports that Shafik emphasized her commitment to increase the diversity of people and ideas and lived experiences while in her new role. U.S. Congresswoman Rashida Tlaib tweeted her outrage this week that the State Department is moving forward with plans to build the U.S. Embassy in Jerusalem on land stolen from Palestinians. She said that by doing so, the United States is complicit in the illegal confiscation of Palestinian property. She asked President Joe Biden to reverse this policy from the era of former President Donald Trump immediately. A story on the Trilateral Summit comes with details, so stay tuned and we will be right back. Welcome back. King Abdullah of Jordan, Egyptian President Abdel Fattah al-Sisi, and Palestinian President Mahmoud Abbas met in Cairo on Tuesday. This was to discuss the latest developments related to Palestine. During the Trilateral Summit, the three stressed the need to end all illegal, unilateral Israeli actions that are undermining the pursuit of a two-state solution. Al-Sisi and Abbas also reaffirmed Jordan's custodianship of Islamic and Christian holy sites in Jerusalem. The three heads of state also emphasized the importance of maintaining international support for the work of the UN Relief and Works Agency for Palestine refugees. They concluded with a statement reaffirming the need to preserve the legitimate rights of the Palestinian people. They also emphasized the need to continue efforts to achieve a just and comprehensive peace based on the two-state solution. A BBC documentary revealed that a secret UK government report found that Indian Prime Minister Narendra Modi directly responsible for the 2002 anti-Muslim pogrom in the state of Gujarat. But by Wednesday, the UK Daily News reported that YouTube had taken down the film. It is not clear why YouTube censored the documentary titled India, the Modi Question, which was aired on BBC Two. Around 2,000 Muslims were massacred in February and March 2002 in Gujarat, India. The UK official report found that there was widespread and systemic rape of Muslim women. The aim was to purge Muslims from Hindu areas. The report says that the violence was organized by the extremist Hindu nationalist group, the Vishwa Hindu Parishad, or VHP. That group is part of the RSS, the extreme Hindu nationalist group of which Modi was a member. Saudi Arabia hosted its first ever Women's International Football Tournament this past week, with games ending today. The event was officiated by the kingdom's first FIFA-licensed female referee, Anoud El Asmari. Saudi Arabia, Comoros, Pakistan, and Mauritius participated. The Saudi side defeated Mauritius 1-0 in the opening match of the tournament, while Pakistan beat Comoros 1-0. Yesterday, Pakistan went on to lose 2-1 against Mauritius, and Saudi Arabia beat Comoros 2-0. In a new report, Oxfam said the world's top 1% grabbed nearly two-thirds of the $42 trillion in new wealth created since 2020. That share was almost twice as much as money as the amount obtained by the bottom 99% of the world's population. It also noted that billionaire fortunes are increasing by $2.7 billion a day. Meanwhile, at least 1.7 billion workers now live in countries where inflation is outpacing wages. The report was released to coincide with the annual meeting of the World Economic Forum in Davos, Switzerland this week. The annual meeting brings together global business and political leaders to discuss political and economic issues of global concern. It is being attended by 52 heads of state and nearly 600 CEOs. On Thursday, Jacinda Ardern announced that she will quit as New Zealand's Prime Minister next month. She said she does not have the energy to seek re-election in the upcoming October polls. Ardern choked up as she detailed how 6 challenging years in the job had taken its toll. She will also step down as the Labour Party leader no later than the 7th of February. Ardern became Prime Minister of the island nation in 2017. She achieved global status for her response to a terrorist attack on 2 mosques in Christchurch. An Australian white supremacist murdered 51 Muslims and injured 40 at 2 mosques in the city while they were offering their Friday prayers. She said, "I hope I leave New Zealanders with a belief that you can be kind but strong, empathetic but decisive, optimistic but focused," The Guardian reports. Coming up after the break is our in-depth analysis segment, so stay tuned and we will be right back. Welcome back. Americans are delaying their medical care due to high costs. To discuss this in detail, let's go to Imam Abdul Malik Mujahid. Over to you, Imam Mujahid.
Thank you, Saamiyah. 38% Americans delayed medical care due to high cost last year. That was alarming. But the same today, news came out that Pfizer is kind enough to provide medicine at cost to poor countries. Are they under some pressure? What is going on in our country? Why people who are sick cannot get medical care? To discuss all of that with us is Dr. Jim Kahn. Welcome to Muslim Network TV.
Thanks for inviting me on.
Dr. Jim Kahn is a professor of health policy at the University of California, San Francisco, and an editor and blogger at Health Justice Monitor. Professor, isn't this extraordinary that 38% of Americans delayed medical care due to high cost?
It's stunning and deplorable. In our country, where we spend far more than any other country on healthcare, we have managed to arrive at a system where the insurance that people have is essentially non-functional, that due to high costs of care, due to high deductibles, so the first portion of medical expenses not even covered by insurance, and due to all sorts of cost sharing, people with insurance can't afford care when they need it. And of course, people without insurance also can't afford care. Our system is entirely broken. It's unclear what we're trying to accomplish anymore.
Wasn't Affordable Care or Obamacare supposed to help with this situation?
Yes, but Obamacare did a couple of good things. One thing it did is it made the rules that health insurers need to follow fairer, so they couldn't take away health insurance after someone got sick, for example. But Obamacare did two very unfortunate things. First of all, it encouraged the expanded role of private for-profit health insurers in our system. So more people now are covered by companies who have a primary goal of making a profit. And so one way they accomplish that is to make it harder for people to get care. The other specific, very unfortunate thing that Obamacare encouraged is the use of high deductibles. These are, again, it's the amount of money, often now many thousands of dollars, that the patient or the beneficiary is responsible for at the beginning of the year before the care even kicks in. This has always been part of health insurance, but the deductible amounts were quite small. Now they're huge, and this is one of the main reasons that people are finding that when they need care, they can't afford it.
So Obamacare, which was supposed to help the situation, in this area is not helpful at all.
I'm sorry to say that while there was some good things about Obamacare, including financial support for people to get insurance and expansion of Medicaid, there are some serious unintended negative consequences. And this to me is a critical one. Another one is encouraging the role of private insurers in our best public insurance program, Medicare. Medicare is increasingly being controlled by private for-profit companies. So these changes are just tremendously distressing and unfortunate. And what we are doing in these matters is nothing like any other wealthy country around the world is doing. We are uniquely inept at designing health insurance, and any thought that we could fix this broken system should be set aside, and we should be imitating what other countries have demonstrated works extremely well, which is give everyone the same insurance, publicly fund it, and get rid of all of the distractions and waste that we currently have. We could be covering everyone so that the answer to the Gallup question, instead of being 38%, might be 0%. And we could do that while saving money for the entire system. It is completely ludicrous that we haven't done it already. There have been efforts in the past, but we need to keep fighting for a single payer, Medicare for all. That's the way we can solve this problem.
Professor, when Obamacare was being discussed, there was a high level of discussion and a debate and all that. Then Republicans came and they kept fighting that we're going to dismantle it, this and that. So there was some discussion, although not a positive direction. Do you think there has been any discussion on this topic which has captured the imagination of our nation in the last couple of years?
There have been many discussions that have captured the imagination of the public. And in particular, if you ask the public if they would support the federal government being responsible for providing health insurance with some new taxes, but with no more premiums, no more deductibles, no more co-pays or cost sharing, then the support is extremely high. It's about 65%. The problem is that the discussions that go on in the halls of Congress are different, and the influence of the insurers and other highly profitable corporations on our legislators, certainly Republicans, but also most Democrats, mean that it's very hard to get the public will, as I see it, into the legislation process. We do have two bills in Congress for single payer. One is the lead sponsor is Pramila Jayapal in the House, and of course Bernie Sanders has a bill in the Senate. It's a slog, but when I see numbers like this from Gallup, my first reaction is exasperation and depression. My second reaction is people will be empowered to more forcefully compel their elected representatives to make the kind of change that we need. So I encourage your listeners to think in those terms of getting into law what the people want, which is universal health coverage.
But Professor, the challenge is this: the Gallup poll that 38% of Americans had to delay seeking the medical help in 2022. I mean, you open CNN, Washington Post, New York Times, or maybe what you got in over there, the Chronicle, or anywhere. This is not the headline. This is not the secondary headline. This is not even the main homepage of this website. So this is what I'm concerned. That is the debate gone down? Resolutions. There are plenty of resolutions introduced in the Congress. They don't go anywhere until there is a public pressure. So, of course, we at Muslim Network TV are discussing, but by and large, it seems there is no steam behind all of this.
Yeah, I'm not sure I agree with that entirely. I certainly have seen in some widely available news services that they focus on issues, for example, of not-for-profit hospitals suing patients who can't afford to pay. That's gotten a lot of press coverage. The fraudulent behavior of Medicare Advantage private plans to deny care has been covered. There was a very well done piece in the New York Times, which is mainstream liberal media, talking about the Medicare cash cow machine. So I do think that there is coverage beyond the left, the most left outlets. It's starting to get covered by absolutely respectable, middle of the road media. And I think that the hurdle, as I see it, is that even though this is covered, the assessment of the mainstream reporters and editors and publishers is that as good as a single-payer system would be, and they often acknowledge that, they claim that it is not politically viable. And so I think I see trends in the right direction, but you're absolutely right that there are many forces who would prefer that we don't talk about real healthcare reform and therefore don't cover these problems.
So who, Professor, is number one responsible for high costs, the insurance company or the drug companies or the circuit of hospitals?
Yes. The answer is yes. All of them have a role. And first of all, there has been a consolidation of providers into delivery systems, much of it funded by private equity. And if a system has a big market share in a particular area, they can drive prices up. At the same time, the insurers, who then have to pay those higher prices, are making sure that their profit margins are generous and are doing their best to suppress care, and they're taking a big chunk. The drug companies are charging way too much. And in addition, we have an entity that is a new invention, a new American invention called the Pharmacy Benefit Manager, which is another corporate structure that is interposed between the insurers and the pharmacies and claims to be saving money for patients, but there's no evidence of that. The evidence is that they figure out how to make money for themselves. So there are many profiteering entities within our system who are working together to drive up costs. And then, of course, there are the complicit politicians.
Professor, there is a news today that Pfizer is going to provide medicine at cost to poor countries. Is there a pressure on Pfizer, or they have changed of heart? They have become a good citizen instead of a money-making machine?
You know, this is not a new issue. It started in many, many years ago and really accelerated as an issue on the world scene with the development of antiretroviral therapy for HIV. So that goes back to 1996, when we had our first multi-drug, highly active antiretroviral therapy, and the prices being charged in the United States at that time, about $15,000 per year, were way out of reach for poor countries. And at that time, slowly but steadily, there were agreements to produce drugs, often in India, for the low-income country market. And the prices came down to a few $100s a year, and now they're well below that. So there is a long history here, but I'm sure that Pfizer, while they're willing to support the low price access, also see this as a huge branding opportunity to brand themselves as caring and kind. We're working on an analysis right now that asks the question, how much of the profits being made by Pfizer and others involved with vaccines would need to be redirected to sub-Saharan Africa to fully vaccinate against COVID. And it turns out that it's only a relatively small portion of their profit. So they're trying to look good, but they are certainly focused on getting those profits and making their shareholders happy.
Well, thank you so much, Professor Jim Kahn, for your time.
I'm very glad to talk with you.
Back to you, Saamiyah.
Thank you so much, Imam Mujahid. That's all from our Toronto studios tonight. Thank you for tuning in. You can find previous episodes and more on our YouTube or Facebook. For more content, keep watching Muslim Network TV or visit muslimnetwork.tv. Assalamu alaikum and good night.